Hey guys, my name is Thoria, a second year MBBS student at NHLNC Medical College, Ahmedabad. So today's topic is how you can study all the three subjects without getting overwhelmed. First, you try to study all the day, but there will be burnout at the end of the day. Or if you had studied for 30 days, then there will be a session of about a 1 week or something for that. You will not have any courage to muster to study. You will write many notes but can't read them at last time because at the times of exams you have to just have a few hours to go through thousands of pages. You have to memorize anatomy, but you forget in where is the nerve supply muscles, what are their original insertion. MBBS isn't about more studying or remembering, it is about studying and remembering things at the right time. First, in physiology, mainly try to read the books and revise from the flowcharts or markings you have made from the book or from the notes. Let's say you have to connect dots. First, for example, in homeostasis, you should write if a 6 mark question is asked, you should write define. Then you have to enter a two subpoints: positive feedback, negative feedback. Then in positive feedback, you have to define them. Then write examples such as clot formation and etc. In negative feedback, write hormones that negative feedback and that now also add a feed forward mechanism, then add that how brain perceives stimulus, then again it can, or try to remember like it a cycle or a story. First, let us take an example of a cardiac cycle. First, there will be arterial systole, ventricular systole, then isovolumetric contraction, S1 sound will be there, then there will be ejection fraction will come. Then you have to write prodiastole or ventricular diastole, isovolumetric relaxation, and volume filling stage. You have to try to remember events, then draw drafts and label them. First of all, if I say that in that suppose in cardiac cycle, you have to last to draw about arterial filling, ventricular filling, how pressure difference this will be there, how volume difference will be there. You have to make a graph about that. Then you have to remember something of everything to write as a question can be from anywhere. This is a line that our professor has asked, tell us that was very inspiring to me. You have to remember something of everything. And if there will be an example, I say if you want to do endocrines, if you are studying endocrines, then you have to remember all the hormones. Then you have to remember how their action works, what will happen, what will be effect on the body, such as what would be effect of carbohydrate, fats, lipids, proteins. There will be breaking or formation, etc. What will be the BMR? What will be the other things? What diseases could it make? What is it life-threatening or such as aldosterone, life-saving hormone, and that all you have to remember. These are the points that questions can come from anywhere. There is not a fix, but certain things that you could remember. So this will be helpful. In anatomy, the main problem is that you have to remember two things. First for Viva and second from theory. So everything you read in theory will can or will come in Viva. And in Viva also, most of things or some things can come with theory. First, I will talk about Viva, Osphere, etc. about that things. First, you have to remember muscle attachment, origin, insertion, nerve supply, and action. You have to remember most of all it, but not of all. The main important ones, the nerve supply, action, and that. Bony markings, special features, peculiarities, and fractures, such as bony markings of the certain bones you have to remember, such as in radius styloid process, it's how it helps in identifying right side or left side bone it is. Then you have to remember special features about that bone. Then peculiarities you have to remember, such as in clavicle, it is the only horizontal bone in our body. So you have to remember these different things. In fractures, you have to remember. how a bone can be fractured, what are the commonest fractures, etc. Then in embryo histoviva, you have to bear with it because there is nothing in histo I can say is that slide identify. There will be two slides. If you are in Gujarat University, I can say that there will be two slides asked, and about that the questions will be there like three or four or can be two or three depending on the teacher. In my time, Viva, there were five questions each from each slide, such as if a slide from the sperm is asked, or we can say testicle, or that is asked, then they can be asked what is the function of Sertoli cell, what are the maturation phases of spermatozoa, how are what is spermatogenesis, that could be asked. You have to do the X-ray and surface from the VD Chorasa if you are referring that book, or you can see X-rays that are present in your college also. Now, second of all, we are asking now about apart from Viva in theory. In theory, you have to do Viva things, and in Viva also you have to remember theory things. But certain things such as muscle and that will not come in theory, except few, such as deltoid is a good example that can come in theory also, or we can say semitendinosus, membranosus, and that muscles, hamstring muscles can come in theory. So certain exceptions will be there that they can come, such as gluteus maximus can come, so you have to connect with them. In upper limb, do certain most IMP questions. If you don't have time, I would suggest to do everything, but as we don't have time to do mammary gland, brachial plexus, axillary artery, then many other questions, then at the last you can say do joints, nerve supplies, in all the three nerves, axillary nerve, etc. Do accept this there are any other 10 markers. These are the just I have taken for the reference purpose. There are many other 10 markers in upper limb, so you have to do them. Then do all clinical about that, such as in brachial plexus, you have to remember Erb's paralysis and that all Horner syndromes will come. This you have to write about that if brachial plexus is only asked in 10 marks. So you have to remember this also. Do 6 marks according to your college and university. As I said, इसमें रटना तो पड़ेगा पर you have to do other things except this, such as questions can be from asked anywhere. Such as आप मैंने जिसमें से कहा कि कोई और भी 10 मार्कर आ सकता है आपको, इसलिए आपको सभी कुछ करना तो पड़ेगा ही कि नॉलेज आपको होनी चाहिए. अब आए बायोकेमिस्ट्री की बात. So in biochemistry, most of I say is do miscellaneous such as acid-base balance and that other things. This is very important. Tumor markers and other things, suppressor genes. These are very much important. For the basics, I can say is that in carbohydrate, lipid, and protein, do chemistry basics such as homopolysaccharide and that, or do certain defined certain storage disorders such as glycogen storage disorder can be asked. Certain errors, certain specific examples such as if you have been asked in carbohydrate for s orbitals can be asked along with it example such as cataract and that can be also asked. Diabetes mellitus can be asked. Diabetes ketoacidosis can be asked. Do remember these things. So in metabolism, you have to remember all such as beta oxidation. These are some of the things that questions can come in. So in biochemistry, questions can be from anywhere and you have to be prepared. So these are the just the points that are to guide you. So we can say that in the end, if you like this video or have been benefited by this, you can share this to your friends. These are just the points that I have experience or from my experience I can say this might not be applicable to you, and even if this has helped you, please consider subscribing